No, you guys are all doing really great work. So
likewise,
we trust
you.
This is
with our
definitely
reopening.
taking everybody, yep, to continue to just get in line and to keep sharing these messages.
Yep. Absolutely. Okay, well, I have 2 o'clock. Be respectful of everybody's time. I see we still have a few folks joining, so welcome to Briefing with Brooke. So glad to have you on today. Today's topic is reopening Maryland safely, and I'm so pleased to have a really, really wonderful lineup of folks today. I hope Ken is able to get on. I don't see, Ken, are you on yet? Have you? Hopefully he's able to hop on too. But we are so pleased to have such a great group of folks today to talk all about sort of the ins and outs and what to look for to make sure, and thinking of the process of reopening as well and how we should be thinking about it. This isn't, of course, going to be one day or next day everything's open kind of thing. So really delighted to have everyone on today. So I'm going to start with a few comments. I'm Delegate Brooke Lierman. And I am proud to represent District 46 in Baltimore City, along with my teammates, Senator Bill Ferguson, Delegate Luke Clippinger, and Delegate Robin Lewis. And although we work as state delegates, we work hard in the city, we work hard all around the state to pass and implement policies that affect the entire state. Before we begin, I just want to make a few points about where we are today and why host these briefings. I think that being an elected official is about a lot more than passing legislation. It's about connecting people with the resources that they need, driving discussions about important topics, and advocating for change in multiple ways, including through important discussions like this one. And I fundamentally believe that government is about reducing barriers to success and creating opportunity for all, and of course, keeping our residents safe. And that is really at top of mind these days. And as we find ourselves in this great pandemic and public health crisis and economic crisis, everyone is hurting in some way. And we have to make sure that we are taking care of those in most need who are facing challenges. So we have the luxury today of sitting in our homes, but many people do not. Our essential workers, our transit drivers, our grocery store workers, our state employees who are taking care of our elderly in state nursing homes, they are at lines, and we have to do everything we can, all our hospital staff, to make sure that as we reopen, we don't make things worse for them and for the people who have to be outside. Today we have 35,903 confirmed cases in Maryland, and over 1,700 people have died from this disease. We have more than 1,500 people in hospitals right now. Governor Hogan, of course, he announced that he'll be lifting the mandatory stay-at-home order as of tomorrow at 5 p.m. That stay-at-home order is being replaced by a safer at-home public health advisory, and that is for houses of worship that can resume services with safety measures. Outdoor services are encouraged. Some retail stores and some personnel services will reopen with limited capacity. But really, Marylanders have to continue practicing social distancing and wearing masks in indoor public areas all the time. So, these are the things the governor has made legal for Maryland. However, he has left it up to different jurisdictions to decide when they will take these actions. And different counties are going to implement phase 1 of reopening at different times, depending on their population density, their disease burden, and other factors. So currently 4 jurisdictions have 72% of the state's COVID-19 cases: Baltimore City, Baltimore County, Montgomery County, and Prince George's County. And these counties, I believe, and I'm guessing many of my guests do too, that these counties need more time to safely reopen while others may be ready to start the process. And I think that actually at 3 p.m., so right after this today, the mayor is going to have a press conference at the War Memorial to discuss his plans, and he and County Executive Johnny Olszewski are working really hand in hand, which is great to see. So here today to talk about the phases of recovery and what the phases of recovery will look like for Maryland and for Baltimore. I'm so delighted to have Al Hutchins, Shalonda Stokes, Alicia Wilson, and Ken Skskrej. So I think we're going to start today with Al. So delighted to have you, Al. Al, of course, let me pull this up. Is Al is joined Visit Baltimore as president and CEO in November 2018. As the chief executive, the city's official destination sales and marketing organization, he's responsible for overseeing the promotion of the Baltimore region as a destination for conventions, meetings, leisure trips, day trips, group tours, and family reunions. In addition, of course, to serving as a hospitality industry's liaison to the business, civic, and local community. I have been delighted to have the opportunity to work with Al over the past few years he's been here. He is just done amazing things at Visit Baltimore, for Central Maryland and our region, and has always been a wonderful partner, and I'm thrilled to have him kick us off today to talk a little bit about what he sees. I'm going to turn it over to you, Al. Thanks.
Well, thank you, Delegate Lierman, and let me just first say thank you for the invitation to be a part of this great panel. And I also want to thank you and the entire Baltimore City delegation for the continuous support of tourism. You've been a great champion of what we're trying to do, and I really appreciate your support. So thank you for that. And also I want to do a thanks to my colleagues on the phone today with Shalonda and Alicia and Ken, and we're all in this together. So I really appreciate the great work that everybody's doing. So the delegate was very kind to give you a little backdrop on who I am and what we do as an organization. And I'm grateful to that. And I want to just show you a couple slides, data points, just to sort of tee this conversation up, because Visit Baltimore has always done great work in the city and as well as the state. But COVID has really changed the game for all of us, especially in the tourism industry. We are essentially closed down. And so if we could go to the next slide here, this sort of starts the conversation, because in travel and tourism on a national perspective, the spending money in travel and tourism, if you look at the month of April, we're 86% down in revenue that's normally spent in the travel and tourism business. May, the projection's about 75% down, June, 60% down. And, you know, we're trending in a better direction in the fall, but even in December, we're still 35 points off of where we normally would be. So on a national level, and this is from Oxford Economics, they provide us a lot of data points. Nationally, the impact of COVID is 9 times worse than 9/11, to give you some perspective. So this is very, very serious, and it's sobering to look at the numbers. And on a state level, you should know, if we compare last May to this May, spending in the state of Maryland is down 88%. So it's a huge impact on the state. And then if we go locally, I mean, essentially most of our hotels are closed. The ones who remain open, their occupancy is in the low teens, and many are in single digits. And so a number of our hotels have laid off a complete staff of people, you know, and you've heard our restaurateurs are closed. And so from that end, nationally, statewide, and locally, you know, this industry is taking a huge hit. And you're talking about in Baltimore City and the MSA, this impacts about 85,000 people who work in this industry. So that's significant. They're out of work. So with that said, though, I think part of the good news story is there's some work that's happening now. I sit on the COVID Tourism Task Force with Secretary Schultz that was put together by Governor Hogan. So I'm a part of that group, and we're talking weekly with my colleagues from around the state for when the state does open back to meet and convene. What should we be doing to tell the state of Maryland's message? And obviously we heard Governor Hogan has loosened up some of that as of yesterday. So certain parts of the state are back open, golf courses are opening, and parks are back online, and a lot of outdoor activity is back. So we're starting to have some deeper conversations. On the local level, Mayor Young has put together a COVID-19 task force as well, and chaired by Ms. Stokes, that's on the call with us today, and Shalonda and Councilman Costello leads that charge. And I'm working with that group to make sure on a local level, we're going to be ready once we get on the other side of COVID. And I think it's extremely important that we as leaders, we work together to determine where we go once there's a good time for us to open. So one of the things Visit Baltimore was doing prior to COVID And you see some of that with the slides because this is our new look and feel. We changed our logo and we changed some of our branding, but we put a pause on our new brand rollout because it wasn't appropriate for us to be celebrating travel and tourism and our industry is shut down. So
Sure.
at the right time, we're gonna open up and we're gonna launch this new brand along with some civic pride campaign that our 5 surrounding counties have joined us on. And the real good news story, I believe, when in the travel space, there is some pent up demand, quite frankly. And this slide shows you some of that data point. As of early May, when that question was asked, I miss travel, can't wait to get out and travel again. We're coming back up over 70%. And I will tell you this weekend with 85 degrees tomorrow and, Saturday is going to be nice. There are going to be people in the street in Baltimore out and about because people want to get out. So the pent up demand's there and we're going to be ready for it. And then the last slide will just show you the good news story as well when it comes to travel is when they asked the question this fall, do you really want to travel? And over 53% folks surveyed said either they agree or strongly agree that they want to travel. And here's the real good news about that data point. Folks aren't going to get on airplanes in this fall, but they will want to get in a car if they live in Richmond, live in Pennsylvania, Jersey. They'll drive to Baltimore and stay for the weekend and visit our museums and visit our restaurants. So we think we have a huge opportunity to reach that leisure visitor and talk to them about all the great assets we have in the community. And the last thing I'll just leave with Delegate Lierman is that there's one question that we're going to have to answer before we reopen. And the question is, what are we doing for public health? And so, Shalonda and I have been having this conversation along with others that we have to answer that question. So Visit Baltimore is working with an international association to see if we can bring an accreditation program to Baltimore City for hotels and restaurants and venues to use as a sort of good housekeeping seal of approval that we can stamp on our windshield to let folks know we're practicing hygiene, cleanliness, our employees can feel safe as well as our visitors. So that's an initiative, Delegate, that you'll hear more about moving down the road. And we're excited about leading the charge on that one. So we're ready at the right time when we say we're open.
Yeah. Well, that's great. Thanks for sharing this with us. And I think you're right. I love the idea of some sort of certification too, because people will want to visit and will want to frequent places that they know that they and their family will be safe. And so if there's some way to let them know that, these businesses, we have really figured it out. You can come here, enjoy yourself and be safe. That's a great idea. And now I'm really delighted to turn it over to Shalonda, who you mentioned. Shalonda is the president and CEO of Gribo Media and a longtime board member of Downtown Partnership of Baltimore. And earlier this year, she stepped in as interim president of the Downtown Partnership and executive director of the Downtown Management Authority. It's been my great pleasure to have the opportunity to work with her in that role as a member of the board at Downtown Partnership. She's been a true leader, and she is also helping to lead the business reopening task force for the mayor. She and Councilman Eric Costello, who I just talked to, are leading our reopening efforts. And so they really have their finger on the pulse of, what we need to be doing to support our businesses, but also to make sure that everybody understands we have to be safe when we're doing this, because the worst thing for business, would be to reopen too quickly, have people get sick, and then everybody come back again. So we don't want that either. So thank you so much, Shalonda, for joining us today. I'll turn it over to you.
Thank you so much, Delegate Lierman, for having me. To my esteemed panel, love you so much. Al was doing a little bit too much showing off with his slides. But in Visit Baltimore fashion, I would expect nothing less. So kudos to that team over there and the leadership that they're doing in it. Delegate Lierman, thank you for your leadership on our board. With Downtown Partnership, you're right, stepped in as the interim president right now for that. And it's been a whirlwind in there. And so couldn't do that without the leadership of our board. When I stepped in, it was early sort of in the COVID transition. And so following the governor's orders at that point in time, all of our team was home. And so that meant not only the team members who had the ability to work from home, but even some of our operations teams, so clean and safe and all of that. Because at that point we didn't know, I think as an organization, they didn't know what to do. I did work with the mayor's office and some other to get our team members designated essential, and so that we could at least have some clean streets and safety. But at the same time, we needed to make sure, like everybody else, that our team members were safe. And so we needed to get proper PPE and set up protocols and guidelines and all of the things that, as Al started to talk about, we want to get people back here, but we want them to know that it's safe at the same time. And so we instituted those protocols. And so our teams are back out working now downtown, especially as the weather gets nicer. People are starting to come back. And as you mentioned, Governor Hogan sort of relaxed some of the restrictions, especially around the parks that we maintain. We're trying to figure out too how we keep people safe with signage and all of that social distancing, while at the same time allowing people to get out. And so we're doing some of that on the operations side. On the marketing side, and I'll shift to a couple things, but on the marketing side, part of what we recognized our immediate need was to protect the base, right? And our base at that point, it is going to be the hotels, the restaurants, the arts community, and all of that. So we've done a number of either webinars and or CEO roundtables to kind of figure out what is the big challenge. I know money and opening and all of that, but if the governor and the mayor say press go and we don't know what's going to happen at 3, are we prepared to press go? So as many areas as we could sort of formulate guidelines and safe practices and all of us do it at the same time, that's what we'd like to make sure that we're helping institute. And so I thank you for, I'm hearing one of our shows is Downtown Download that we do every Tuesday to get the information out, and a big call from the arts community. It's been tremendous on our end, and on the, not this Tuesday coming, but the 26th, I'm hearing that you will be hosting.
I will be a guest. Yes. I'm excited. I'm psyched. I'm going to be a guest on the Downtown Download. Yeah.
Downtown Download. And part of the thought is that we're doing it every Tuesday so that we can hear not only from our leadership in terms of the politicians, but also engage some businesses who are in the practice of all of that. Right. So we're trying to make it down home. Another project that we did, and this one proved to be, it's all of them are evolving. We're trying to say, how do we jump in and help? The restaurant community we knew was hurting tremendously. Mm-hmm. And so we were a part of the team that got behind the hashtag Curbside Baltimore, so that right. people would know which restaurants were even doing takeout at that point in time. So you could follow that to see. We evolved that program into what we called Curbside Baltimore. And that did a couple things. One, we infused some cash into those restaurant owners. So 25 restaurants were selected. We purchased a boatload of gift cards from them in denominations of $20. And the thought was that we would sell them, and we're selling them though, and people get $30 worth of value for the $20 purchase. And so right. literally now for the restaurants, the impact on them has already been nearly $30,000 for some of them. And so we, testimonial wise, they're saying, thank you, thank you, thank you, please continue. But it's trying mm-hmm. to figure out how do we bridge the gap, because we know people need money right now, and provide incentive for people to go out and do some of those things. So that's one of the initiatives that we did. Another one is Heart of the Park. And that one is done in partnership with Harbor Park Garage, where it's free meals, right? And so we've partnered, we're taking donations through Downtown Partnership so that we could offer for people when they come by, and we're doing those, giving out now approximately 200 meals a day, but they come and they get a meal not only to take with them at that moment, but one that they could take home as well. Mm-hmm. And so we're trying to figure out a balance between business and just the community give back component, because many of the people who are hurting right now are displaced because, their organizations had to close. And so really working to do that piece. And we created, hopefully everybody saw the thank you video that came out of Downtown Partnership with it. And it was a thank you for everybody who's staying home, who's doing their part, giving meals, serving in the hospitals and all of that, because it together, and you all said that this is the way that we're going to be able to do this together. And so a number of initiatives there, doing some things around voting. Of course, with the election coming up, we are encouraging people to make sure that they get out and vote on June. I mean, not get out and vote, but mail in the votes.
Mail in your ballot. You should, Baltimore residents should start receiving their ballots today and tomorrow and Saturday. So they were mailed out on May 8th.
Oh, mailed out. Perfect. Thank you. Thank you. So we want to do our part to make sure we're circling back. We also did a survey with some questions of the candidates at the mayoral level and president and city council level. And so if people want to go to our website and look at some of those responses, they can. We are encouraging, no matter how you decide, please vote with all of that. And then I just want to shift a couple minutes before I yield, because I know once Alicia comes on, she's going to just steal the show. But I wanted to talk a few minutes about the task force that I chair with Councilman Costello. And I mean, just an amazing set of people who are on there. And Delegate Lierman, I thank you even for your leadership around it, because while we know everybody can't be on it, what we are is tentacles to feed in the information to make sure that as we advise the mayor and advise, businesses on this, that it is a collective approach to that. We are coming fresh off of another meeting. So I don't know how you did your timeliness of this, but you're getting information.
I don't know. It's crazy. Yeah, who knew?
And all of it. Yeah. Part of what the task force itself is around figuring out how we provide guidance and recommendations to reopening Baltimore. In addition to that, there's the $5.5 million fund that's broken up into 3 categories, and I'll just very quickly run through them. $500,000 has been designated for PPE, and not just towards the purchase of PPE, but the so what big deal to that, I think Mayor Young's leadership was really great, was to figure out how we build a base of manufacturers here that could make the PPE. And so they would focus on small businesses and how they could, maybe it's a retailer who needed a $2,000 part or something to add rubber bands onto what they do. So now they can make masks. And that has been going very well. The city did their first order with one of those manufacturers. And so all of this stuff is starting to churn. And so $500,000 is designated to that. 1.5 million is designated to neighborhood sort of redesign with that. And part of that is we recognize while the restaurants are going to be hit hard, we'll need to figure out how we can do some outside seating. And that may be, some parklets or different things to allow it, maybe taking over parking spaces. It's working with the city to figure out how we adjust for minor privileges and different processes that it took to now have outside seating. And so we're really aggressively working on that, and 1.5 million is designated to that, BDC leading that effort. And then the really big deal and the timeliness of this is 3.5 million of it is reserved for small businesses. And in that the application period closes tomorrow. And so 15 in grants, not loans, but grants up to $15,000 are going to businesses. And the requirement is, Baltimore City for those. But the great part about it is businesses who were left outside of the federal procurement, the CARES Act. So immigrant-owned businesses, businesses with owners who may have had a felony, or all of those other sort of hurdles and things that people had to go through with that. This program tried to eliminate all of that. And we did it such that, it opened May 4th, it'll close tomorrow. It wasn't on a first come, first served basis, because part of the thought is let's step back and see how we can help as many businesses in the most impactful way as possible. And so that's sort of the efforts of the task force. And I won't steal the thunder of World Central Kitchen. I'm sure you will bring that part back up, but I do want to say thank you for inviting us to the table as we really expand the process of what was happening and identifying how restaurants could also join the movement to helping food distribution. So I know it was a lot of time.
No, thank you. You're doing a lot at Downtown Partners, a lot. So all our businesses appreciate it. I appreciate it. You're laying an important foundation in keeping people afloat. So thank you. I'm delighted to turn it over to Alicia, who's the Vice President of Economic Development for Johns Hopkins University and Johns Hopkins Health System in Baltimore, Maryland. She leads a core team focused on developing and implementing Hopkins institution-wide strategies and initiatives as an anchor institution in and around Baltimore, and the elevation and expansion of Hopkins' signature commitment to the city through investments in economic and neighborhood development, healthcare, and education. And I'm really interested to hear, Alicia, what your thoughts are today. I mean, you of course work at a healthcare institution, and you are a wonderful attorney and longtime friend, and just really to hear your thoughts today on what reopening will look like and how you think businesses and large employers and institutions like Hopkins are coping, and what it will be like for them to reopen. And, you know, maybe if we don't know when that will be, what the process will be and what the stages will be for reopening. So thank you for joining us.
Oh, no, my pleasure. And Brooke, anytime you ask me to come to anything, I'm always coming.
Thank you.
I appreciate your leadership in Annapolis, but more importantly, your leadership here in Baltimore and convening things like this. I really appreciate it. And to my esteemed panelists, next time, please do not put me after Al and Shalonda, but more Ken, because at least you saved me a little bit of pain.
No worries. No worries. Thank you.
Yes, no problem. So, you know, Hopkins in many ways, and when I was confronting, you know, the questions that were posed and this notion of reopening, in many ways, we never closed, right? And so as an anchor institution, you know, we find ourselves in many ways the same way an anchor does in a storm, right? Really trying to ensure that, one, our institution is able to weather this storm, but also the city that we reside in. Our positioning as, you know, the largest employer in the city and in the state, coupled with being really a clinical leader, not only here, but all over the world. And the pandemic puts us in a really neat intersection of being a source of information, a convener, as well as a delivery of care. And so we take that really seriously. And we think about what that means for those who are in our employ, and that is from the security officers who greet you at the front door, to the patient transporters, to the doctors that are sitting on the COVID unit. I mean, everywhere in between. We really think about our front line as is much more extended, as well as into the family units that are a part of our family. I mean, last night I had a very, very personal thing happen where my aunt got put on a ventilator, frontline work. Oh. This work is so real, and our work as institutions are so real in terms of what does it mean to reopen? And so I start that by, you know, sort of level setting on that. I think there are two sort of significant contributions that I think we as an anchor can play and are playing in this question around reopening for our community at a large. The first is on one which was launched actually right after we all sort of went into our homes. And that was a private partnership that involved not just Hopkins, but ALMS and Care First, really wrapping our arms around the city in a way really coordinate care. What we knew is that this pandemic is like nothing we've ever seen before. And so the tactics of the past are not, cannot be the strategies of today, or even those that we can think about in the future. And so that was stood up literally in a week, with first making a deep investment in 211 and creating a call center, which, you know, anyone, whether you have a primary care physician or not, can get care. Hopkins really stepping up in a way that makes me so proud to be a part of that institution. Many times doing things without any press, no fanfare, being a leader in testing the homeless population in the city, thinking through and partnering with the city government on how to address issues of the most vulnerable populations, and also being very active in just counteracting these hot spots and things that we are seeing across the city. Because although many of us are home, to your point that you made earlier, many people never stop going to work. Right. And many of them are some of the most vulnerable populations within our community. And so how do we render care? I've been, my heart has been filled with gladness at the work of, many across our institution, like Kathleen Page and Sharita Golden and Kevin Sowers and Paul Rothman and Ron Daniels, who have really stepped up in a real way to dig deep into our community. So through that public-private partnership, the work that you see going on throughout the city has a little bit of puppet strings of all these healthcare leaders really informing that response. I would say, is the work we're doing around the Anchor Strategy Work Group. And that's where I have to give a huge plug for Shalonda. We stood up an Anchor Strategy Work Group across our institution in literally 4 days. And really had a number of different components on that. But one of the things that we knew at the very outset was that education and information was power, right? The ensuring that we stay connected to one another in a really robust way was critical. Shalonda volunteered. Thank you, Shalonda. She created our parent
really
town hall.
volunteer? Was it really volunteer? Okay.
We'll tell her I got it, but she volunteered. We held town halls for parents and children. And tonight I'll do a town hall for residents in public housing, as well as seniors. And that has allowed for us to be a real information channel through which the city and the state are able to understand some of those issues, but also we can be rapidly responsive to those issues. I also bring up a couple of things. Let me, before I know the time will get away from
No, you're good. You're good.
Really the work of Josh Sharfstein with his daily podcast that is actually allowing us to drill down into really census tract and seeing where people are being infected. The 6,000 individuals in East Baltimore that are receiving food through our food access program, as well as the 4,000 meals that we've provided, not just to frontline workers, but to individuals who are food insecure for whatever reason in our employ at Hopkins. I think all of those things are how we're trying to address. And I do thank you for your leadership, Delegate Lierman. You've been a great partner in being responsive on so many of these fronts, and the reason why you're just proud of leadership like that in our city and our state. And so I just thank you for convening this group today, but also just your leadership that no one knows about.
Thanks. Well, thank you. I appreciate that. And, I really appreciate the work that Hopkins is doing on some of the food security issues because, with Build and others as well, because a lot of that is in many of the immigrant neighborhoods that have a high number of immigrants, like in Baltimore, in my district. And, we've been coordinating a lot of food access conference calls and trying to make sure we're catching everyone, but there's always more to be done. So thank you. Thanks for that. Now we're gonna turn to Ken. Ken Skashesh. Did I get it right?
So good, so good.
Yes. Woohoo! He is our wonderful executive director of the Maryland State Arts Council since 2017. He has been emphasizing procedural equity as the path towards quality arts experiences for all Maryland residents. And before that, from 2014 to 2017, he was the coordinator of fine arts for the Maryland State Department of Education, where he shared his creativity and collaboration as the driving force of success for all students. Now, Ken is overseeing a large amount of work groups, a number of work groups who are working right now to talk about how the arts industry and its very many components, because there are so many different parts of it, can safely reopen. So Ken, I thought it'd be wonderful to hear from you. You, of course, are part of the State Department of Commerce. You could talk a little bit about what you see as challenges to reopening and the process toward reopening. And then we're gonna go over some of the questions that people sent in. So Ken, take us away.
Thanks very much, Delegate Lierman. Thanks for having me today. And Alan, Shalonda, and Alicia, you're all three quite inspiring. So thanks for having me on this call. I would first just like to say that as soon as the governor declared the state of emergency, we launched a series of listening sessions. We did 4 listening sessions that were open to the public, followed by 14, we called them creative conversations, that were discipline specific, arts discipline specific, or County Arts Council executive directors, but arts group specific. Attending all of those calls, we had more than 1,000 constituents give us feedback about what they needed. Obviously, they needed to be heard. They needed their fears to be recognized. And we used all of that information to move in 3 directions. The first direction was, what could we do as the State Arts Council by taking immediate action? The second was, how could we develop professional development models to help folks do things like move their creative work online? That's just one example. And then the third category that came out of all of that listening was, how can this information get to a task force to inform the governor and the General Assembly? And so, as Delegate Lierman just mentioned, the task force has launched. I have served on task forces in the past that have taken 6 months simply to organize, and then another 6 months, right, to do the writing. We're doing everything from organization to implementation in about 3 weeks. So the 6 work groups that have come out of the task force are, the first is collaboration. How can we encourage particularly arts nonprofits to think of a collaborative model for the future that allows them to be both stronger in their service to their communities and economically more viable? The second work group of the task force is looking at funding opportunities. What funding opportunities exist for artists and arts organizations currently, and what new opportunities may come out of this pandemic or will be needed because of this pandemic? The third of the 6 is online engagement. What are best practices for online engagement? The fourth, and I think this is the biggest lift of all 6 groups, is in-person engagement. That group is grappling with the largest number of questions, because for the arts sector, our venues, our meeting places are vastly different. A ballet studio, a dance studio is very different than the Hippodrome Theater, but both fall within the arts sector and need best practices for reopening. The 5th is marketing the reopening, and the 6th that Delegate Lierman very generously serves on is the advocacy work group. And how can we get the message about the arts sector and its needs in front of the governor and in front of the General Assembly? So I want to focus in these few minutes on both the online engagement and the in-person engagement work groups, because I think they are most relevant as far as forward vision goes. So from the online perspective, that group is focusing on best practices from 2 different perspectives. One is educational. So anything from webinars to arts education, moving from classroom to virtual services. So they will look at everything from, best practices about what's happening in the background, which has become a point of focus for education, our general education as it's moved virtually, to appropriate materials and how they are shared so that they can reach the largest number of both young people and adult students as settings like libraries begin to reopen, how we can reach communities that are currently dealing with the fact that they have no online access. So that's online engagement. And then in-person engagement, as I said, is broken down into venue types, and will create best practices. The 4 areas, and these actually came from the governor's office, so I wanted to share them. The 5 areas to focus upon are how the site is prepared, how the workforce is prepared, the creation of a social distancing plan, how the site is controlled, things like reducing touch points, controlling access, increasing cleaning, and finally, how all of those procedures are communicated to stakeholders to build their confidence to return to public spaces. So
those sound like 5 very good. I mean, that sort of sums it up for every business, I would think.
Yeah. So I, as we're all experiencing, these things are evolving moment by moment. And so I'll be resharing that information with each of the work groups of the task force to give a little bit more focus to the final reports.
That's great. And when will the final reports be available? Do you know yet?
Fingers crossed they're heading to Secretary Schultz. A week, 1 week from today, which seems completely preposterous, but we're going to try it. And then the final bit of information for me to share is that through the CARES Act, we received almost $500,000 from the National Endowment for the Arts. We isolated an additional $500,000 of funding from the Maryland State Arts Council, launched an emergency grant within 4 days, and have already reviewed all the applications and processed the $1 million of grants. We granted 65 arts organizations and 60 independent artists across the state using that $1 million. Yep, that's the update
great
from the Arts Council. Thanks.
That's great. That's great. Well, I'm going to stick with you for 1 minute because there was a specific arts question. How has the Hogan administration been reaching out to the Maryland State Arts Council regarding the effect on your sectors? Does the administration recognize that the arts sectors will not be able to earn revenue? It says until phase 3. I'm curious for your thoughts, how you feel like it's been going.
So the line of communication has been clear through the Department of Commerce, so through Secretary Schultz, and also I'll share through a direct line with the First Lady. So because the First Lady is a professional artist, she and I work very closely, so she's very aware. And in fact, she and I had a long conversation yesterday. Phase 3 focuses specifically upon large venues and our theaters, and those are the spaces that are both, I wouldn't say suffering the most, but there's a tremendous impact on the theater industry and those theater venues. And so they're of great concern right now because without a vaccine and without testing, there are several models that are floating around about how we're going to get people back into theaters, but none of them can move forward confidently without testing and eventually without a vaccination.
Right. Thank you.
Sure.
Now there are 2 other questions that folks wrote in, and I'd love to have your feedback on them. Just anybody can take them, but one question was, do you expect that there will be specific required practices put in place to govern a reopening process? And equally important, what kind of enforcement mechanisms should be in place to ensure compliance? Any thoughts from your industries and what you're seeing on, whether they will be, at the institutional level or smaller businesses, or, Al, if you're talking to tourism agencies or anybody on specific required practices put in place to govern the reopening process and how those will be enforced?
Delegate Lierman, if I could start, and this is one of the conversations we just had on the task force. I think at a high level, my answer would probably be no to specific restrictions, not that there will not be encouraged suggestions. And part of the reason, and we're trying to figure out, and it aligns sort of with Governor Hogan's strategy as well, is what we can enforce, it's hard to regulate. And so part of what we recognize is saying all of these things are absolute no, unless you're going to do something about it on the enforcement side, it's really tough. And so similar to Governor Hogan's strategy, I think that there will be at the local level, and even within some of our organizations, there will be some guidelines and things that we put in place with the hope that as it goes down, institutions and organizations are making that applicable to what they do in enforcing at that level.
Yeah, that makes sense.
The only thing I would add was there also are a number of public health reports that sort of help spell out some best practices for businesses. One that
Hopkins has one. Yes.
You say?
I said, you guys just published one.
Yeah, we have a couple, and one's really a really good one I commended. One written by colleagues Crystal Watson and Caitlin Rivers and Scott Gottlieb and Mark McKellen on a roadmap to reopening. And that piece really does help you to think about reopening more as a dimmer switch than as a light switch. So really how we come back to what is a new normal really looks at a dimmer approach as well.
So Alicia, if I could just piggyback on your comment, because I think that's right on the money that we're dealing in a situation that because until there's a vaccine, we could
Yeah.
we could reopen, and then all of a sudden we have to close again, right?
Yeah.
And so I think all of us are trying to figure out what is the happy balance or what's the happy dance there that we can meet. And the position that we're trying to take at Visit Baltimore, we want to be in total alignment with Governor Hogan, the healthcare and the scientists, CDC, and whatever, and what the city would do. We do not want to get out in front of the science. And I think it's because again, we're dealing with something that's life or death, right?
Mhm.
And we need to be careful with having this robust opening. And I think your analogy of a dimmer is really apropos here. And I think all of us, as we look at our guidelines and protocols, we need to make sure that we have something in place that if we were to have to put a pause on it again, that we're prepared for that one. And I think that's going to be real important, because I think we're going to be on a stop and go for quite a while. And we're seeing that in the data that we're receiving from visitors, that they're not comfortable right now. There's no consumer confidence at all. And because each state is running it themselves, that makes it even that much more complex.
Mhm. The only other piece I would offer, Brooke, is that there was another report that was just put out calling for 100,000 workers in contact tracing, and really utilizing that public health tool, which is not new, but is new for this pandemic in a really robust way. Hopkins just created a free course that anyone can sign up for those jobs. It's a free training, don't have to pay for it, to be able to get a contact tracing job. And really that can help us to really get this pandemic into a manageable level, and be able to not spike a surge, really understand who's spreading it, how it's being spread, and really try to tamp down and flatten the curve that we're still seeing on it increase.
Right, that's interesting. That's great. And I just put, for folks who are interested, I just put the report, the Hopkins report on the operational toolkit for businesses considering reopening or expanding operations in the chat box, so folks can access that. It's a great tool. I think that actually goes to the next question that I think is really opening, which is what guidelines will be provided to employers to have existing and new employees return to workplaces? This is something, you know, the guidance to employers on how to do the right thing, right there. You know, when you decided to open a restaurant or a bagel shop or a gym, you didn't know that you were going to have to be a public health expert in order to keep your employees safe, right, and your customers safe. So I'm curious from your point of view, what you're seeing, what the work groups are going to recommend, where the guidance will come from to allow some of these employers to know that they're opening in a safe way. Has that been tackled in any of the work that you were doing, or who is tackling that? If not you all, like, are there other places that you think that you expect to see come out with that?
I think, and we'll find out some of sort of where the guidance comes from at 3 o'clock, but I know even part of the reasoning behind the task force is to leverage all of those best practices that are coming out. The Hopkins report was a major component of our call today, combined with their other sort of industry experts that we're pulling to the table to do a framework that we could all sort of live by. And so I know through the task force, we want to issue some of those guidelines around what happens. The thing that's tough in this part is there are so many different types of business sectors that it'll be just that, because you know, where we may be able to do something for restaurants in general, it's going to be very different than a restaurant with X capacity, you know what I mean, to try to do some things for others. And so part of it is really trying to do a framework that's tight enough that people can respect it and figure out how to implement it, yet broad enough that it allows for the flexibility within the different segments.
And do you expect the mayor's task force and work groups to come out with some of those guidelines?
That's what we're talking about doing now. And so a lot of what we plan even for the next one, we asked the task force members today to really culminate, pull out some of the best practices that we have so that we could streamline a lot of that, because what people are asking for is that guidance. And I think to what Alicia and both Al talked about, we want to make sure that we're doing it responsibly with health first in there. And so, you know, the health commissioner is part of the task force and everything. And so all of that is pulling in all of those resources. So you will see some of that coming out of the task force.
That's great. When do you know when the task force will be reporting out?
So we don't have a set full report, and we're hoping that some of that will come because it's following between the governor and the mayor's timeline. But what we do know, and I would encourage people to come to the meetings, are actually open to the public, although, you know, for in there. And so I welcome people to participate. The phone number and stuff is accessible on the mayor's office page, but I welcome that. And will, for you, Delegate Lierman, really start to, as we get the timeline, make sure I feed it to you so that you could share it with your base.
That's great. Thank you. Other thoughts on?
Well, Delegate Lierman, if I could just add, and I think we need some uniformity, right, on what these protocols and best practices will be, and Shalonda and team are leading on that with the mayor's guidance. But I also think it's not going to be hurtful for us to have different layers of best practices, right? Because this one, folks are scared and they really don't know what the answers are. And I think as a community, in a very interesting way, with COVID doing so much negativity to the country, I think with Baltimore, and I'm looking at it from a marketeer's perspective, I think because Hopkins is here, and every night you turn on TV, there's someone from Hopkins being interviewed.
Right. Yeah.
And I think that's something that we need to champion, because we are a healthcare mecca. We always have been. And in a very strange way now, I think it's something we can celebrate the great work we're doing, come up with these protocols and best practices. And I think this could help us as a destination to really begin to put a different filter on Baltimore of the great work we've always done. But now, because of COVID, it's forcing people to take a closer look at the city. And so if we can come together on these protocols and best practices and accreditations, I think it'll give us a strong leg up moving forward as a city.
Right.
That's a great point. Yeah.
I was just going to come back. I think you're absolutely right in terms of the layers. I think there's a guidance piece, but the piece I don't want people to miss is what you talked about with the sort of good housekeeping seal of approval in there. People are really scared. I think that we need to figure out how, if there can be some sort of accreditation piece to what we're doing to say this place is safe, our city is safe. I think it will at least start to instill some level of confidence back.
I agree, Shalonda. And and Alicia mentioned it with her loved one who's on a ventilator. I think when we get on the other side of COVID, this is going to touch all of us. We're going to know somebody, some family member, some friend that was negatively impacted by COVID. So I think all of us are saying the right things. We have to develop some level of comfort to individuals, and because people don't have any confidence right now.
Yeah, I think that's very true. And I want to be respectful of people's time, so we're going to start to close it out. There's a great comment in the chat box by Kelly, who noted that we're in a slow motion trauma and that we're eager to think about how we weave in resiliency with our rituals of reopening. And I love that idea, because I think so much of what this is such a traumatic experience for everybody. And whether, just because of, being scared and staying at home, the risk is so great, but also that not being able, the normal way that we comfort ourselves as human beings is to hug one another, to be next to one another, food to one another. And we can't do any of that. And so it makes the situation uniquely traumatic. And I think part of the resiliency that we are going to have to include, and why we'll be able to be resilient, is through the industries that you work in and the work that you are doing, whether it's Hopkins, making sure that our businesses have the best information to reopen safely, whether it's Al and making sure that people can continue to explore our neighborhoods and our city and our world in a safe way. With Ken and the arts, making sure that people are able to reach out and touch, even if not physically, experience their favorite art, and Shalonda with all the businesses being able to get a meal from your favorite restaurant, and thank the chef. Last night we walked up to Upper Fells Point and picked up some Indian food, and the owner is this lovely woman, and asked me if I had kids and gave me a free mango lassi. Just like the little gestures that people do are so important. So I'd love to hear any last words on from you all on what you think the process of reopening look like, or just words of caution or hope that you'd like to share with folks today.
I'll jump in if you don't mind. I've been spending a lot of time guiding folks from sitting where they are, in this moment of trauma and fear, toward envisioning a brighter future. What are we learning? We know our world is cleaner because of being put on pause. We're learning a lot, and there's a lot of positive coming out of this. And from the arts community, I envision a resurgence of the arts as a response to this time like nothing we've ever seen before. So I'm very hopeful.
Like the roaring 20s after the flu. Everybody kicked up their heels and started dancing, right?
Yes.
That is quite.
Thank you.
I echo what Ken is saying. I think our future is going to be bright. We've had tough times before during the history of this country. We've overcome all of that. We will get to another side, but I think right now, I hear the word empathy a lot, and I think that's a word that we have to be empathetic with each other. We have to be very thoughtful as to we make decisions, because this is life or death, and we have to listen to our medical and science experts as we navigate down the road. And I think health comes before the economy, and I think we need to make sure we do this the right way and really be sensitive to the thoughts and concerns of our individual citizens.
Yep.
I would echo what we've heard so far. I'm sure Alicia is going to chime in the same. I think that what's unique about this time now, especially for Baltimore, is this is happening beyond just our city, right? And so it's bigger than just us as a unit. I think collectively, this is a true time for us to collaborate to break down silos that we had internally, where organizations at one point used to compete. We need to band together to figure out how we do this together, communicate consistently. And so Delegate Lierman, things like this is what needs to happen. I know some people are probably feeling they're on Zoom overload or conference call overload, but each time there's one new person or two new people who didn't get the message. And so we can't communicate too much at this time. For me and Al, I had that word. I love the word empathy. I think that at this point, we're at so many different levels. It takes empathy for us to get through this, to know that, to the point that was made earlier, while some of us are home and somewhat comfortable, there are a ton of people who are struggling to eat in a house full of people, and students who may not have access to certain resources. And so, we need to figure out how we get even beyond ourselves and comfort to figure out how we can help along the way.
Mm-hmm. That's great.
And the only thing I would say to I think within this storm, there are blessings that we have had to figure out, connect more deeply, differently, and on a different level than we ever have before. We've had to sort of stare in the face of our inequities and also deal with our most vulnerable in a way that we have never before. And I hope we come out of this very different. I hope we don't stay the same. This is traumatic for all of us. It has become in many ways an equalizer and an unequalizer, a balancer and an imbalancer. And so in that vein, I hope we learn the lessons that we're supposed to learn during this storm so that we are better on the other side. And I'm hopeful that we are. I am.
Yeah. I couldn't agree more. I think that's absolutely right. I'm going to put our information up here too, so folks can contact us if they'd like to. But a huge thank you to all of you for the work that you're doing to lead us through this, to help us think about reopening in a safe way, in a robust way, to help us be a resilient society. And I always like to end these with a note of gratitude to everybody out there working on the front lines. You know, whether you are a transit driver, a farm worker, or anyone out there who's working to keep us going. I think, Alicia, what you said is absolutely right. You know, these are many times the folks who we had to fight very hard to increase their pay for. They're some of the folks who make the lowest amount of money, and yet we are completely dependent on them right now. And hopefully that helps us recognize their value to us as a society. So thank you so much to all of you for joining us. Stay safe, be well, and keep in touch. Thank you.
Thank you.
Thank you.
Thank you.
Thanks, guys. Thank you.
Bye.
Take care. Bye.